Rotary. Bless the food or use, masterdize service. In your name we pray. Amen.
The officers in here today, so Katie will be leading us in the pledge.
Please join me in the pledge of allegiance.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
Thank you.
Please be seated. All right, we've got a bunch of pop-ups today, and we're going to kick off with a pop-up by the rock star, Judy Matheny. Judy, come on up here and give us an update on what's going on at Riverside High School. Let's make Judy feel welcome.
Okay.
I used the branding section from the Rotary thing that we learned at that's pretty cool. You can get all the logos and colors and everything.
Has a project, and they are taking Easter baskets to the children at the Sulzbacher home. And that's the home that most of you know for people who are interim displaced, not necessarily homeless, but there's a lot of younger children in that group. And so they're making assembling the Easter baskets themselves, and they have run out of or need additional things. Now, here's the problem with this is they need it by April 7th, which is this coming Monday. So if anyone thinks that they can help out with this, and I'm going to read you what they need right in just a second, come find me, okay? Because we'll coordinate how we pick it up and make sure it gets to the school by the 7th. But they said, Easter basket drive, some things we still need, canned treats, baby treats like the little puffs, teething rings or baby toys and diapers, then deodorant, body sprays for the older folks. If you would like to, I think that just either bringing the materials is an idea, or if you think that you might want to assemble an Easter basket yourself with maybe a puffy toy or something like that. Leave it up to you, but please get with me and I can coordinate. I've got some time this weekend if we need to run back and forth and deliver things. Thanks. That's it.
Very good. All right. Tom Tappan from Southjax-Rotary. You're going to talk to us a little bit about what's going on with your fundraiser, right? Come on up here. Make it feel welcome, Pat. Thank you, for really good Southjax.
Thank you. So I just wanted to personally invite you to come to our annual fundraiser at the Bowl School. It's our Derby Gala. It's April 26th at 7. It's a really good time. We have the chants, we have dancing, we have food, we have music. So please come and join us.
If you remember,
questions,
because I never do,
I'm happy to talk to you.
to get
There's a
some
QR
batteries.
code on the cards on your table. You can purchase tickets through Patton.
Well, if you want to come, we can add it, can do it for them.
Yes,
Games of chance.
it's not gambling, but that's real bad. It's for charity. No, it's, well, it's for a good cause. Dreams come true.
All right. $100 a ticket.
It is, the early bird price is $100.
Are we still in the early bird thing?
Yes, and we may extend it, but it ends soon.
All right. I'm gonna buy 2 tickets just because you're here.
Oh, well, thank you so much.
Patty, would you sign me up? I'm gonna go to the Derby fundraiser. All right. But before then, we're gonna take their money for the Alhambra, right, Steve? We're gonna try. We're gonna get the lot like that. You got a good report?
I think so.
Tell them how many tables you sold.
Patty, how many tables have we sold? Looks like about 25 or so.
22 tables so far,
22 tables
out of 75.
out of 75.
We got it.
Get the word out.
Hey, everybody. Just wanted to touch base with you. Realized last week that we're kind of at crunch time because we've got a service week coming up and then the following week is Easter, which means this is our last meeting until a meeting the day before our Alhambra event. So really need to kind of consider this the 2-minute warning, if you will. This is definitely not a walk-up event. So we need everybody to make their commitment right away if possible. And I wanted to go over. Okay. Again, the event is April 24th. And, we had a pretty ambitious goal, and we know that this club can come through. And we're also reaching out to other clubs in our area. I want to thank you, and I want to thank Ike for the efforts that have been made. And so we'll definitely be getting with you, but we want to get everybody from Area 6 involved. Just want to go over one thing with you real quickly. The Alhambra charged us $61 last year for the ticket, dinner, cocktail, gratuity, and tax. They're charging us $62.28 this year. So although I am a nerdy accountant, it doesn't take an accountant to realize that that's a very small markup compared to everything else that we buy. So not only do you get all of that, but the remainder of the $100 goes to our charities, which are primarily for this earmarked for youth services. So, I mean, it's going to be a great presentation. Everything I've heard about the Carole King story is that it is just fantastic. I am putting my money where my mouth is, and it's kind of funny because I think that I'm one of few Georgia Bulldog fans in here. But I'm doing a platinum sponsorship. My wife and I are, and 4 of the people that are going to be sitting with us are Gator graduates or Gator fans. So if that isn't a sign of commitment on my part, right, Katie? Katie and I used to work together, so I got to rag on her about football, and she ragged on me about everything else. Anyhow, we've got the sponsorships available. We really need to make our reservations right away. Can I get a show of hands of folks that have already made their reservations? All right, great. Well, that's a lot of the people in here. So perhaps all of you can get on the phone, what have you. I sent out an email this past week. I only got one wrong email address returned, so I think everybody got it. So we need to, if you can, we tried to make it very easy. All you have to do is send an email to Patty to make your reservation. So I'm not going to take up any more time. My email is on the sheets that everyone has. It's going to be a great event, and appreciate everybody.
Thanks so much. We get 2 weeks.
Well, they got 2 weeks, but it would really be great if we could have them active the next day or two.
So like in the next day or 2?
Yes.
All right.
Yeah, we really want to get the commitment so that we can reach out with a good handle to the Alhambra folks and let them know what to expect. Thank you very much.
Thanks a lot, Steve. Thank you. All right, I think that Jerry Kelly is here. I saw Jerry when I came in. Here he is. Jerry Kelly, come on up here. Jerry Kelly from downtown Rotary. You are here so often. I think we need to, you should switch from downtown. No, I'm serious. I like it. We really appreciate it. Do they have fried chicken?
No,
See?
you guys had the best fried chicken when you were over there. They came out to that meeting just for the fried chicken.
Right. Want to tell us today?
Couple, 2, 3 things. Obviously, not everything is. Or Westjax and other things that are going on within Area 6. The same day, we have training in the district, which is 7:30 to 3:30. Those people who are affected, about it. I already talked to Raul, he knows about it. The other things that are happening today, I was going to mention the Derby festivities. It's Southjax. There's still tables available. The best bargain you can get is a table. If you want to pay $800, I think you get 10 seats for $800. I think that's still available. The Beast Feast is April 12th, which is out in McClenny. It's at the Cruz Family Farm. If you enjoy eating strange animals, fried, that's it. They also have a fundraiser. If you're interested in purchasing or taking a chance on purchasing various different firearms, that's an opportunity. There's rides, all kinds of. That's April 12th. The Rotary Club of Jacksonville is sponsoring a literacy festival. I put things on your desk or on your table. That's the same day. It's for rising juniors or people similarly situated, trying to figure out how they're going to pay for college, what kind of debt they can take on, how that's gonna get paid off. That's gonna be a day, of 8 or 9 speakers walking you through that. So if you have people that you know who are interested in going to college, you don't know how they're gonna pay for it, don't have any idea of what kind of commitment they're gonna be making, that's an excellent opportunity to go do that. That's the 26th at Florida State College, Jacksonville downtown. Plenty of parking. They're also gonna get a $10 gift certificate. They're also gonna get some handouts and different things different available. And all the people who are involved in that process will be in that room. So again, it doesn't affect any of you personally, but it may affect some people you know. But how about you?
What do you gotta tell them? It's not me.
Oh.
Thoughts, right?
Yeah, and I'm looking forward to Carole King. My wife loves Carole King and we bought tickets right away.
All right, did I forget anybody? Does anybody have a pop-up? Anything they want to share? How are we doing? We doing good? All right. Family of Rotary today is Palmer Bell. Palmer, come on up here. Hope you got a joke for us, Palmer. I'm still laughing about that.
That's sure it's some jokes.
I'm here today on behalf of Alberta Hips. Alberta was to have the month of April. And when I reached out to her, she said, I'm sorry, I can't do it. I'm at home with my husband who's just entered hospice. That triggered something in my feeble mind that Alberta is one person. But we have a number of members, some of them longtime members, who no longer make our meetings on a regular basis. Some haven't been here in a long time. And that made me think, well, if I mention Alberta, you know who Alberta is. If you've joined in the last 5 years, you will not know any of these folks who are hit and miss at this point because either they have health issues or a family member or a special individual in their life has health issues and they're caring for them. So you see Alberta over here on the left and you work around Bob Hyde is anxious to get back. He still hasn't come back from heart issues. Alton was just here for the interview with Raul, but that was the first time in a long time. So Alton Yates, Jerry McCool now lives out at the beach and doesn't drive. And so getting here is an issue for him. He's often online. Bill Howie, longtime member, had to step away because of his own health issues. Tom Snyder has a wife with issues, so he comes and goes. And then Stanley Cantor is the winner. Stanley, this is an issue with our pictures maybe. Stanley is 90 years old. That's not a current picture. Just letting you know. But in DAC TV, we have pictures of everybody, and most of us look like we just are getting out of high school. And no one wants to change their picture, of course. So Stanley Cantor, 90 years old, still goes into the office, I understand, still goes into the office and occasionally gets here. He was here for the president's dinner. Anyway, some pictures to go with folks that are no longer regulars. If you know of other people that we can add to this so that we all are on current basis with who's coming and who's going, it would be great. So that's why those pictures are up there. This week's birthdays, actually, because we're going to be gone now, guess next week we're not meeting and then we'll be back. So Del Wallace was yesterday. Shep College is tomorrow. Robert Bavalka is tomorrow. Tom Snyder, whose picture is up there, is on the 5th. Carl Dawson is on the 6th, and Josh Harrison is on the 7th. Happy birthday to all of you for this early part of the month. And then in honor of the fact that we're coming up on the Final Four weekend and tickets to the nosebleeds are probably over $1,000 in a stadium you can't even see the game from. There was a man who went and bought tickets. It took him a while, but he found tickets to the Super Bowl. Got his tickets to the Super Bowl. He's so excited. He gets to the game and he looks over to his right and there's an empty seat between he and the fella on the right. And so he says, I can't believe somebody would buy a ticket to the Super Bowl and then not show up. And the gentleman says, well, my wife and I bought these two seats and she's since passed away. Well, of course, then he thinks, wow, how insensitive to me. So he says, I'm awfully sorry. I didn't mean to offend you. I just, I obviously didn't know. Did you happen to think that maybe somebody in her family, you could have given the tickets to somebody in their family and celebrated her life by giving away the ticket? He said, yeah, I did, but they're all at the funeral. Last week, I'm free.
Last week I was, heard that.
We announced it here in your honor.
We did.
That was good. All right. Now we're going to introduce our guests and visiting Rotarians. And pitch hitting for Joe Springer is our soon-to-be Sergeant at Arms, elect, Katie Quackenbush.
I got a similar thing. Well, I thought that was kind of known enough.
Guessing with us today, you have a guest, do you want to introduce?
When you sign in, it says, this is a private roster.
He's the campus president from Kaiser University.
That's a tricky one.
And we also have Chris Champagne with us today. He is back for our third meeting. Well, we're happy to have you here, Chris. Thank you so much for being here.
Hey, how's it going, everybody?
And that is everybody, but I would like to, could I invite Joe Springer?
Well, I've got a travel in. My Jimmy wanted to say something first. I'm sitting still with the knee, but I received an email the other day, and y'all remember when Rob Kelly was here and talked about Read USA, and they were going to have their big book fair and all. Well, it's here. And he sent me an email the other day, and they're looking for volunteers. And I didn't get it typed up today, but I will in the next day or so and get it out to the club since we won't be together. But it's pretty much for the month of April. And they're mostly at-risk schools, but then there are some like Ortega Elementary, Venetia, one's around here, one's over near Forest High School. You have two shifts. You can come 7:30 till noon or noon till 3:30. Or if you want to stay all day, you can do that. But you're there just to help, to give the books out. They say the looks on the kids' face are amazing when they see this. And we told them that we wanted to get involved because I know they would like to be a recipient of our award that we give every year. And so at any rate, I'll send you an email on that with the information, and you can send it back to me and I'll pass it along to Rob. I know they would be very appreciative because I noticed a lot of nobody's going to be at this particular time and all. So they need help. I think it's a great opportunity for us to help out not only our community, but the kids that are at risk and help them. So I'll get that out to y'all and thank you in advance.
Well, one more thing. I'm going to take a little what you used to call the president's liberty. I just wanted to do, first of all, Katie, thank you so much for stepping up and helping out. If y'all didn't know, I'm going to be out for a while for a little heart situation. So she's going to pretty much be the sergeant at arms for the rest of the year. Dude. Also, I don't know if you remember, but this young man and I, 30 years ago last month, went to the Holiday Inn and we were inducted on March 15th as the newest members. So there's some toilet on it. So we've been around 30 years. 95. Yes, Kevin.
This is just a humorous note on how I got them speech. Phil Voss spoke right before I did. And I had to come after him. After listening to all the stuff he did in the Navy and business department, I just got started. All right, I'm done. Here we go.
It was interesting times, but that's really the reason why I wanted to take a minute. Sergeant at Arms, our requirement is to make sure that we have greeters, that we've got the pledge, that we've got the room set up, four-way test. They're just little pieces to it. And we send out an email to the people who have the assignment. Back at the Holiday Inn, it wasn't a request that you may want to do someday if you don't have anything else on your mind to think about. When that email came out and said that you will be doing the pledge, that's your job for next week. It's your job. And then we've got the prayer, then we've got the four-way test, we've got all the pieces of it. And it's amazing, back in the day, because I'm old enough now and been here long enough, I can say that. If I had the prayer to do and couldn't make it, it's my job to find one of my buddies and ask, can we swap sometime? Hey, listen, I can't do the prayer this week. Any way you can cover it for me? We didn't wait until an hour before the meeting and say, I'm unable to attend, sorry. Well, I know it's just a little thing. And that's just a little thing, and that one's just a little thing. It all piles up. I can handle it. Katie will be able to handle it, but it's just so much easier if you remember. It used to be, you just don't say no. Rotary asked you, you don't say no. Do it. And if you can't do it, because there are those times, it's your job. You find your replacement and let Katie know. That's it. I'm finished with my sermon. And I'll see y'all in a couple, 2-3 months.
Thank you. Maestro, that's your job. You're gonna keep us in order. And you're gonna do everything you can to make sure we're in order all the time, even when you're not here. So let's give Joe some encouragement. We're gonna see you back in a few weeks, I hope.
I really, if it all goes well, maybe 5 or 6, if it doesn't go well, maybe 3 months, but I'm gonna be back as soon as I can.
And the surgery is later in April.
April 24th, they go in, they cut me open. Randy's gonna stop in and look because he said I never did have a heart. He's gonna want to see that.
Oops.
All right, this is his youth awards.
You'll be back.
I was watching the nasty you, and you came in that first week, you were moving about like this.
More about passes and about all right, I'm sorry, I didn't mean to pay you one. Let's have a blessing. Well, Joe Springer and Chef. All right, guys, and that's out of the program. We're about to bring out the man of the hour, who's going to introduce the man of the hour. It's probably be my favorite time of the meeting is when I get to introduce Highbar and we need to introduction. Let's make it feel welcome. Raul,
I got to earn that title, Mr. Johnson. Thank you. Thank you very much. Boy, these are all tough acts to follow. Perhaps the toughest of all acts to follow is Paul Harris, of course. Last week, in reflecting about the presentation, when Odette, a visiting Rotarian, shared with us about HCA healthcare, and it's more than 2,000 sites of care across the country. We learned that it is also one of the premier medical centers and providers in the country. As patients and as patients in general, we all want doctors to put patients first. And I am proud to say that Dr. Ravi Pande is committed to this principle. Being there for patients, even during critical times, watching patients make a full recovery can be very rewarding for him. Dr. Pande is originally from India, where Rotary International has had a significant presence, 4,600 clubs in India, 175,000 members across its country, and the great work of Rotary that takes place in India. Dr. Pande is a neurointerventional specialist and director of the stroke program at HCA of Florida Healthcare Medical College, and his studies in India, and then eventually making the journey over to the United States, where he continued his training at places like Syracuse University and SUNY Buffalo. That's the State University of New York at Buffalo. And advanced training at the University of Florida. And for you, Jimmy Kelly, go Gators. At HCA Memorial, Dr. Pande and his team of professionals are passionate about providing care for several vascular diseases, including brain aneurysms and stroke. He's proud to share with us about the advances in technology. Dr. Pande and his team can effectively diagnose, improve treatment, and arrange enhanced rehabilitation. Here to present to us more about the clinical experience, his work at the hospital, including procedures and the conditions they treat each and every day. West Jacksonville, please welcome Dr. Ravi Pande.
And thank you, everybody. Hear me? All right, so I'm gonna briefly talk about stroke. Just not just the information about stroke and what causes stroke, what are the risk factors for stroke, but also the treatments we provide at HCA and other hospitals around town. Quickly move forward with the slides. This is not working. All right, we can go forward. One more. All right, so what is stroke? So stroke occurs when you have either a blockage of a blood vessel in the brain, or you have a rupture of a blood vessel in the brain. So blockage of the blood vessel will cause something called ischemic stroke, and rupture would cause hemorrhagic stroke. So ischemic stroke is the most common type of stroke. That's about 85% strokes are ischemic, and then 15% are hemorrhagic, either intracranial hemorrhage or subarachnoid hemorrhage or some other type of bleeding from ruptured aneurysm or ruptured blood vessel. So the most common, like I said, is ischemic, which is because of a blockage of the blood vessel. And that blockage can happen from a plaque, let's say from a carotid that's flew into the brain, got occluded in a smaller blood vessel, or clot from the heart that travels to the brain, gets lodged in one of the bigger blood vessels in the brain. And you can see there a little bit the thrombus on that picture going into that blood vessel, and then rupture would be like a small blood vessel that's just ruptured in the brain. And so about 800,000 Americans will have stroke in the United States. So every 40 seconds, somebody's having a stroke. And about every 3.5 minutes, somebody's dying from stroke in the US. So it's fairly prevalent. It's the 5th leading cause of death in the United States. It's actually a 3rd leading cause in women. So women, especially in the 80s, 80 and above, will actually have more likelihood of having stroke than men, just because the life expectancy of women is longer than men. So what are some of the unique risk factors for women? What would be considered risk factor that's just unique to women, not for men? Cardiac, hormones, birth control pills, pregnancy, because you got eclampsia, preeclampsia, blood pressure is higher. So yeah, with women have their own risk factors on top of other risk factors that men have, obviously. And so they're go ahead, we can go to the next slide. So this just talks about these are the scans. You can see this is the intraparenchymal hemorrhage from just high blood pressure. If blood pressure is like 200, you'll have the bleeding right in the tissue. And then that's subarachnoid hemorrhage, which means it's in the surrounding membrane that surrounds the brain itself. It's called dura. It's the bleeding happens around the brain between the two membranes, and it's called subarachnoid hemorrhage. So that's actually more fatal than this. Patients who have a ruptured aneurysm, they have about 30 or 40% mortality right off the bat. Some patients, 20% of patients won't even make it to the hospital because they will pass away before So early aneurysm screening is extremely important if you have first degree family members who have had that. Or if you just have uncontrolled risk factors and headaches, things like that, you can get MRAs to detect that. Next slide, please. Yeah, so what are some of the signs and symptoms of strokes? And these apply mainly to the ischemic stroke we were talking about, and there's a mnemonic called BFAST or FAST, but they extend it to BFAST. B stands for balance. If you're suddenly experiencing symptoms of dizziness, gaining balance. E is for eyes if you're having vision loss, over vision, loss of vision. F is for facial droop. A is for arm weakness. If you ask them to hold their arms up and they're dropping their arm, that's one of the symptoms. S is for speech. If you're having trouble expressing yourself or slurring your words, that could be a symptom of stroke. And then T is just a reminder that time is of the essence. You got to bring them to the hospital. Why do you think that is? What can we do for them in the hospital that you can't do it at home? Drugs, exactly, yeah. So we can give them blood pressure medicine. Next slide, please. There's also, let's do this. Sorry, these slides were prepared by Odette for me. So they may not be in order that I'm used to, but go ahead, go back to the first question. The quiz, the next one. Yeah, there you go. So Jenny, the 81-year-old, was at home with her daughter when she suddenly starts having slurred speech. Her arm is weak. And how long from the onset of symptom can Jenny receive the IV clot busting medicine? So this is medicine that we can give to the patient when you bring them to the hospital, right? It's not just the blood pressure control, CAT scans, all that stuff, but there's actually a medicine we can provide to a stroke patient through the IV that'll dissolve the clot. It's not exact science of literally dissolving the entire clot, but it actually improves the flow around the clot. But it's time is of the essence. You gotta give it within certain window of time, you know? Does anybody here know this? 1 hour from the onset of symptoms. That's pretty, what's that? 2.5, okay. That's pretty optimistic. Honestly, a lot of patients don't make it to the hospital in 2 hours. By the time they have the symptoms, they call their daughter, then they call the ambulance gotta bring them to the hospital. So it's 4.5 hours. So we can give them up to 4.5 hours, this medicine. And that's why it's important to bring them to the hospital as soon as we can. Next slide. All right, so then let's say if the patient's outside that 4.5 hour window. They called you, they said, oh, you know, I woke up, I started having these symptoms, but then I didn't really want to bother you. So I had my coffee and then my symptoms are getting worse. Now I'm completely paralyzed on one side. And they called you, right? They called daughter. She comes in, checks on her mom, and she brings her to the hospital. So this question leads up to that. So let's say Jenny came to the hospital, she got the CAT scans, and then they found a large clot lodged in the brain. So how long before we say we can't help her anymore? How long from the onset of symptoms, you think? It's longer than that. It's actually 24 hours. So you have up to 24 hours if you have a large clot, because when you have a large clot, the area of the brain, let's say that's not getting perfusion, pretty large. So let's say it's complete hemisphere, right? So you start to have a little bit of collateral circulation start to form around it, and start to perfuse that area. So you have up to 24 hours to actually completely, for that tissue to completely die, so that we can't even recover any of it. So of course, the sooner we can do the procedure, the better. And we can remove the clot better, but you have up to 24 hours. Next slide, please. So yeah, those are the two treatments we just spoke about, the IV thrombolytics, which is given compared to IV, and then the mechanical thrombectomy, which is what I do. It can be performed up to 24 hours. Next slide, please. So yeah, this is our machine. This is state-of-the-art machine. artist Icano. This is at our HCA Memorial Hospital. This is the only, this is the newest machine in the entire city. That's our, and we have a team of people that support. It's not just this machine, obviously. We have techs, nurses, but the way this machine works, it has two C arms that take a picture from it's working. Oh yeah, there you go. So there's a A plane and B plane. So we have two planes of view where I can see the contrast flowing through and where the clot is. And then I can aspirate the clot to usually go to the groin or to the radial artery. We push our catheters all the way up. And actually I brought some of these. This is one of the aspiration catheter that goes through your groin all the way into the brain. Pass this along so you guys. Next slide, please. So yeah, that's actually me. That's the. So that's actually an older picture. We have newer technology now, but the idea is the same. So that aspiration catheter would be here. This is not something we use anymore. This is an older picture. But the idea is that aspiration catheter will go right up to the face of the clot, and then we attach it to a pump that has a suction, but it goes back and forth with suction and no suction, and then eventually just aspirates it. Next slide, please. This was a video. Is it possible to play that video or?
Let's see.
Hold your mic up, please. Oh, sorry. So there's a second catheter, that guide catheter that sits in the neck, and then from there I go up. And there's a stent retriever we'll use sometimes to pull the clot out. And if you want to play that again. So you can see it's once it's pause that once in there. Pause there. Actually, this is the second view. That's fine. Yeah, go ahead. So this is actually a real patient. So can you pause that? Oh,
I don't think we can. Oh, here we go.
yeah. So you can see if you go back. A little more. Maybe keep going. Yeah, right there. So this is the clot right there. So this is patient's eye, probably right here. That's the head. And this is the left side of the brain here, left, and this will be right. And this is from the neck. The artery comes up. This is the eye, and it goes up. And this is the major blood vessel that's called middle cerebral artery. So it's right about here. And if it occludes, this area of the brain is not going to get any perfusion. And so this is the guide catheter that I spoke about. And then I push these over a smaller microcatheter, which I also brought, but there's a series of catheters that we use to go up. And then eventually that particular catheter that's going around will get lodged in there, and I use a stent retriever to pull the clot. So this procedure can be done up to 24 hours and has excellent outcomes. We've had patients come in completely paralyzed, walk out of the hospital the next day because the clot literally pulls out in one piece most of the time. Can you play that?
From
So
here?
you can see after I remove the clot, it restores the perfusion to the brain. See that blood vessel? So it's restored. And patients will have an excellent outcome. Depends on how long after you after their stroke you brought them to the hospital, obviously. Next slide, please. Next slide.
Oh, thought that was.
Oh, that was it. Do you have any questions? Yeah.
Really good much.
Thank you for being here today. So, 24 hours, if you can do something within that time, but how much damage is done that can't be reversed if it's 12 hours or 15 hours or something?
That's a tricky question because everyone's brain is different. And we are still trying to figure this out. So it's not really time anymore, it's more tissue. So we look at the tissue, we have a study called CT perfusion. And it tells us exactly how much tissue is dead. So I've had patients even 24 hours out, they've only had 20 or 30% of their brain tissue that has died. Because they have a lot of collaterals. So if you have a lot of collaterals, we can have even I've done cases on 36 hours out of patients because they have not completely stroked out yet. So yeah, it's time used to be one of the cutoffs when these studies were done. So we kind of use that as an arbitrary cutoff of 24 hours, but it all depends. And then there's 25% of patients are actually, and this is too much technical information, but someone called we call them fast progressors. Which means their tissue dies faster at a faster rate because they have only, the pattern of the blood vessels that are supplying that tissue is in a way that their brain tissue is dying faster than other patients. So the 25% of those patients, you have to do these cases within 6 hours because after 6 hours, a whole lot of tissue is dead already, and then it's not worth doing. So it all depends. We use the cutoff for 24-hour, but we actually have these advanced technology, which we use CT perfusion. We have very quick ways of actually seeing the perfusion studies on our phones. So as soon as the patient goes through the scanner, there's a pop, like a notification on my phone. And I have an app that uses AI to figure out how much tissue is dead, how much is alive and viable, and we can proceed from based on that information. We can take them to the bilingual.
All right, we have a question.
First, doctor, thank you for taking the time to provide this educational session. My question is, what can I do now, or what can we do now to lower our risks of developing clots?
That's an excellent question. So the number one preventable risk factor for stroke is intake. It's not smoking, it's high blood pressure, exactly. So high blood pressure, if you have high blood pressure, it needs to be controlled. And it's a fairly straightforward thing to do. Just go to the primary doctor, talk to them, and obviously the other risk factors are smoking, diabetes, obesity, lifestyle, sedentary lifestyle, lack of exercise, stuff like that. There's data that has been analyzed by the American Heart Association. If you're a 50-year-old man and if you have a favorable cardiovascular profile, that means your blood pressure is below 130 systolic, you're not a diabetic, or you're on diet, or properly controlled with meds, you're eating healthy, your cholesterol is good, you add 5.5 years to your life as a man, and you add 6.5 years as a woman, if you're age 50 and if you have all the risk factors controlled. So if you don't have them controlled, then it's the exact opposite. You're losing 5.5 years. So at age 50, I think 5.5 years is a lot. Yes. So it's a good incentive to go to the primary doctor and make sure blood pressure is controlled.
Can you, when the person is in the ambulance, talk to the paramedics and let them administer the clot busting medication?
Excellent question. It almost feels like you know this. I answered it. So yeah, so there's some cities around the country, like Miami has it. Jacksonville is about to get it. I think it's called a mobile stroke ambulance, and they have a CAT scan machine inside of the ambulance, and they have ability to talk to neurologists using the telemedicine equipment. So the limiting factor is we can't give that clot busting medicine if the patient's having bleeding in the brain. So there's 15% of patients that bleed in the brain, rather than having the ischemic stroke. If those receive the clot busting medicine, they would die. So we can't give them that medicine. So one of the ways to figure that out is by doing a scan. So the mobile stroke EMS or ambulance is gonna actually solve that problem. So they go to the patient, they get the scan done right in front of their house, and they connect you to the neurologist, and we can talk to the patient and talk to the family maybe, and give them the medicine even before they come to the hospital. That's an excellent question.
Thank you for being here today. Shep and I had a friend probably, I don't know, 10 or 12 years ago, maybe more than that had a stroke in Jacksonville. And they flew her to Gainesville. And the doctor's name is Dr. Miracle. Did you work with him in Gainesville?
Dr. Who did?
Miracle.
Miracle?
Yeah. And that was crazy. That was his name. But they claimed that he invented this process in Gainesville.
I disagree with that, but that's okay. That's hey, how's the friend doing?
Very well. I mean, she ended up, they flew her to Gainesville like a day and a half after it happened.
I think she probably meant to say this doctor was a miracle doctor. And you thought this was
that was his name. I met him.
Dr. Miracle?
He's in Kentucky now somewhere.
I'll have to look them all. Well,
there seems to be an awful lot of great surgery done through catheters and
yeah.
vessels. I had a heart pump the size of a pencil go up through my leg and next to my heart, and it actually kept me alive for 2 days while my original heart was getting a little stronger.
Mm-hmm.
So my blood vessels must be really sturdy. Can you talk about that a little bit and talk about the risk of perforation?
So yeah, we have to proceed pretty fast. Our door to puncture thresholds are like 60 minutes. So we don't have time to look at the vessels and worry about the vessels. Because we gotta save brain. So yeah, we go through the groin, we go all the way through the aorta, to the heart, into the neck, and into the brain. So I get to see all the vessels from all the way from head to toe. So I have to say the technology is much better. We don't have a lot of complications because if you notice, this was the final aspiration catheter, and you can see how soft it is. And we have the micro catheters that are like even softer than this. If you want to open this, they're very, very tiny. So we use this telescoping method. So we put like a small wire first, and this wire is so small. I mean, I use sometimes loops to kind of see some of this when I'm shaping them. So yeah, the technology has gotten better than in the past. And you can, cardiologists are really good at this because you can't even see, this is the wire, this would be the size of the wire. But this is the micro catheter. And the tip of this is so soft, it will not hurt anything. I mean, if you just like jam this in with a brain tissue, of course, anything will. But some of these things are, of course, there are complications with all of these. You have to be careful. But technology has gotten better. We do even arterial valve replacements now, TAVRs. I don't know if anybody's heard of here or had a family member. So it's valve replacement that's done in the vascular. That's amazing. Very intense procedure, but you don't have to crack open somebody's chest. And even LAD is repaired by stent. So if anybody's had like bypass surgeries in the past, those are becoming obsolete. We have cardiac surgeons who have not done bypasses in months. But Tim, thank you. I appreciate you. Thank you for having me. This was amazing. Check you guys. This is great luck.
I want you to hold the mic for a minute. I got some questions for you. A few things that I didn't hear and I'm really curious about. First of all, in terms of breakthroughs, what's the most significant breakthrough in the treatment of stroke in the last 20 years?
In the last 20 years, other than the stroke thrombectomy, the procedure that I just showed, aneurysm coiling. So we have open neurosurgeons that have not clipped an aneurysm in the last at Orange Park, one of my partners, he has not clipped an aneurysm in the last 6 years now. So aneurysm, being able to treat a ruptured aneurysm or any type of brain aneurysm just endovascularly is amazing. And I have patients that have 8, 9, 10 millimeter aneurysms. I can show you next time you come the pictures of these. They get aneurysm repaired and they literally leave the hospital next day as if nothing has happened. And you can't even see the scar in the groin in a couple of days, and they go back to work within a 5 or 6 days after.
Wow, that's outstanding.
Yeah, so that's,
You
I
know,
think that to me is.
That's the biggest breakthrough.
Biggest breakthrough.
It's interesting because back in the day, it seemed like strokes were more severe. You saw people that seemed to have long-term effects of stroke. Are you finding now that it's the treatment that helps, or are people recognizing that they're having a stroke and getting to the hospital sooner?
So overall, the incidence of stroke in America has actually reduced over the last 3 decades, mainly because of stroke prevention. So we're good at preventing from blood pressure control. Smoking has reduced in men overall over the last 3 decades. So that's one of the reasons. And now 10% of patients get this treatment thrombectomy, which is remarkable. So that's 1 in 10 person that would be completely paralyzed or dead or in nursing home has some chance of recovery or full recovery at times. So that's actually another step. And just like you said, recognition, we're going around educating people to bring them to the hospital because only 10% of patients actually reach the hospital and get the IV clot-busting medicine still. And so that number is steadily increasing in our hospital. Our numbers are about 15% of patients.
But there's a long way to go.
Exactly. You should be able to come to the hospital. That's why people are saying, oh, is the window only 1 or 2 hours? We barely have patients coming to the hospital in the first 2 or 3 hours. They just don't make it.
So if there's one takeaway for this audience, what would it be? One thing you want them to be cognizant of?
If your family member or friend is experiencing any of those be fast symptoms, call 911.
Don't mess around.
Exactly. Don't wait around.
Dr. Ravi Pande. We've got a gift for you. It's a token of our esteem. It's a Rotary coin. I don't remember what it's Rotary. We treated you pretty well, right? Thank you. Thanks for being here. All right, guys. I hope I'm not doing the wrong thing. I'm going to try to turn this off. I don't think I did. Are you okay? Carter, no feedback. I'm good.
We're good.
Okay. Well, we're at the end of our meeting. I want you all to join me in thanking our banquet manager, Tiffany, and the service staff at Timaquana Country Club. They did a great job today. I want to remind you that we're going to be off for the next 2 weeks. On deck on the 23rd, which is the day before our Alhambra fundraiser, are Joe Eberly, Shep College, Tim Alters, and Brandon Hilliard. So no meetings on the 9th or on the 16th, and on the 23rd, Alex Moore will be our speaker. Get your tickets right now for the 2024 Alhambra fundraiser. And then lastly, I want you all to send prayers, well wishes to our Sergeant at Arms, who we're probably not going to see for a little while, Joe Springer. He's going to be back because God loves Joe Springer. Let's make him feel good. Oh, you know, I saw Mike O'Brien. You're going to lead us in the 4-way test. The things that we. All right, everybody, have a great week. Let's get out there and make some magic. Take care.
All right. So we still. Hey, wait, I gotta turn the volume down real quick. So if we don't sell them all, what does that mean? They just put the tickets on.